Having grown up in Tallahassee, I've seen this community really surprisingly expand over the last almost 30 years. And now as the medical director for our emergency services at TMH, I'm really pleased to see the local emergency services expanding to meet the needs of this huge and growing community. And speaking specifically about geriatrics, across the country, there's been the rising age of our general population has drawn special attention to the unique healthcare needs of our geriatric population. And the nation's first geriatric emergency departments were really built back in 2008. And there are many under construction throughout the United States. The geriatric focus for Tallahassee Memorial Emergency Center Northeast will bring our community services, will bring our community a service that is at the leading edge of healthcare. And it'll also meet a specific need for our region. Florida is actually one of 7 states with a median age over 40. And Florida's population has the highest percentage of residents 65 or older. It's actually 17.3%. And so studies have shown that on average, this population of patients uses emergency services more frequently. They have longer stays within the emergency department. They're admitted to the hospital more often, and they're twice as likely to return to the emergency department after leaving the hospital. And so this design for this emergency department keeps all those needs in mind for our geriatric patients. In order to meet that need, TMH is working with 2 firms, as you've heard. One is a local firm, Clemens, Rutherford and Associates, and the other, Freeman & White Incorporated, which is an emergency department design consulting firm that's completed over 200 emergency departments in the United States. And it is considered the nation's leader in ED design, as well as a leader in design for the aging. The new emergency center will have a few features, such as low glare flooring and elements to decrease noise levels, prevent falls, and assist our geriatric patients with the ease of use and wayfinding throughout the emergency department. Really, the many facets of the design, from the flooring to the lighting in the emergency department, are all being carefully considered so the patients are immediately welcomed into a space that's centered on their needs. The thoughtful design is really a precursor for the level of attention and care and compassion that we're all striving to provide for our patients. And in addition to that, all of our clinical staff will undergo additional training in geriatrics to ensure that we deliver the optimal care to our geriatric patients and to everyone that we'll serve here in our community. Thank you.